Now, the head of the NHS has warned that the health service is being pushed to the brink by alcohol-related incidents.
Let's talk to GP Dr. Hamid Khan, who's here for us this morning. Good to see you, as always. Is this really bad? Are we seeing a situation where the NHS is being put under massive strain because of people just overdoing the alcohol?
I think it's important to put this into context. So as a result of the dip in temperatures over winter, we already see a much larger number of admissions of people because of respiratory problems, things like asthma and bronchitis and so on, particularly in the elderly and children. In addition to that, we often see larger numbers of elderly people being admitted because of a reduction of their usual social support networks and so on, carers and families going away. So it's an incredibly difficult time for A&E departments as it is. They're already overstretched, they're already overburdened. And now what we'll see is a huge surge in the numbers of people being admitted purely because of alcohol-related problem. I think it's thought that the numbers will be around 2.5 times the usual, and at some point, almost a third of all admissions will be alcohol-related.
You've got to drink an awful lot, haven't you, to need to be admitted to hospital?
Well, the alcohol-related admissions that we see vary in their nature.
So it could be someone falling over because they're drunk?
Absolutely. People often come in purely because of inebriation and intoxication. We see larger numbers of people falling and suffering things like head injuries. There's also an increase in the number of assaults, people getting into fights and suffering injuries as a result of that, road traffic accidents. So there's a huge range of problems that all emanate from alcohol, although they differ in their nature.
Doctors and nurses, especially in A&E, are incredibly professional and will treat anyone that arrives. But how frustrating is it for them knowing that their resources are being diverted towards people that don't have an actual medical illness, but a kind of self-inflicted problem?
I guess there are two arguments to this. I mean, a lot of people consider these sorts of admissions to be somehow less deserving because they are self-inflicted. As you said, most people know that if they get drunk, then they will be at a higher risk of having a head injury or a fall and so on. But there's another argument with respect to how one can judge or categorize these sorts of things. For example, do we start then saying that people with heart disease have self-inflicted heart disease because they have poor diets or because they don't exercise sufficiently? And I think you've got to look at both arguments, and one has to look at this in a way which is scientific and which is non-judgmental. The one thing that I do welcome as a doctor is the change in the guidance with respect to safe drinking that was introduced last year. The chief medical officer reduced the higher threshold, the upper threshold for drinking to 14 units a week from 21 units a week. I think that's a great move. And she also suggested having at least 2 days of complete abstinence, which will prevent people from becoming addicted to alcohol and prevent alcoholism. So I think we're heading in the right direction in terms of policy, but this is obviously part of a larger issue. We need to look at social determinants, we need to look at cultural factors, and so on and so forth.
Charging? Yeah, there is an argument to say if you call out an ambulance because you're drunk, and actually when you get to A&E, it's not really an A&E situation. Should we start charging people for the service?
I completely understand where that argument comes from, and I totally appreciate that many people suggest that argument from a completely well-intentioned manner. The NHS is massively overstretched. We are facing a huge crisis in terms of funding and so on. But at the same time, I also worry that it might set us on a very slippery slope, which leads to a completely privatized system, which ultimately isn't good for any of us. So I think it's very difficult. I think we need to look at this in a holistic, scientific manner. But all of these arguments need to be considered.
Okay, Hamid, good to see you. Have a great new year.
Yes.
See you in 2017, no doubt. Without a hangover, I hope.
Indeed.